Kevin Brady, Chairman of the Ways and Means Committee. Like many others, I live back home, not in Washington, and when I'm home, I can't tell you how many families, how many small businesses, how many patients have been hurt by the Affordable Care Act. And they are being forced into plans they can't afford, they don't want, and frankly damages them. And so at the Ways and Means Committee, we're working on solutions that will do this first, provide relief to hardworking families that have been damaged by the Obamacare taxes, the penalties, and the mandates. We're going to provide Americans, especially middle-class families who've been left behind by Obamacare, with the freedom to buy a health care plan that's right for them and not what's right for Washington, that is portable, that can travel with them throughout their lifetime, is tailored to their needs, grows with their family, and can be changed throughout their lifetime. We're also looking to strengthen options like health savings accounts, sort of those consumer-driven health savings accounts that can help families deal better with the day-to-day out-of-pocket costs that come with health care as well. So we are focused on repealing Obamacare, replacing it with the types of reforms that work for patients, that return control to the states so they can tailor health care to their needs, and restores the free market so Americans just have more choices.
Good morning. I'm Greg Walden. I chair the Energy and Commerce Committee, and I hail from the great state of Oregon, where I did 5 town halls in the last week. And I'll tell you what, I want to echo what Chairman Brady said. Healthcare is very important to all Americans. We want to get it right. We've been taking our time to do that. And I think you're going to see us come forward with a replacement bill after we repeal that makes sure that people have access to affordable health care for the first time. I mean, I've heard from farmers and ranchers and small business people about what's happened to their premiums, how they didn't get to keep their plan, how they didn't get to keep their doctor. And we've met with states, we've met with governors across the country over the last couple of weeks who understand that this is not sustainable. So you're going to see us move forward on the Energy and Commerce Committee, looking at reforms, looking at a better way to provide help to those most in need in our states and the Medicaid population, and to allow states to innovate. Our state of Oregon has had quite a bit of innovation over the years. We've got the CCOs in place that have actually brought better health care outcomes at lower cost. There are great ideas out there among the states, but right now they have to come back and beg permission from a federal bureaucrat to be able to do much of anything innovative. We want to give states flexibility, and we want to give people better health care. We're going to accomplish both, and the legislation will be marking up in the near future.
Thank you very much. I want to wish you all a very happy Valentine's Day, but more importantly, I want to wish my wife, Judy, a very happy Valentine's Day. And if the cameras are on, hey.
You losers.
Yeah.
Thanks, Kevin.
Would you two like to come back up?
Really.
All right. I do want to thank these two chairmen for the work they're doing, providing when it comes to replacing Obamacare. We all know the challenges, what's happening to so many families, the high deductibles, all those that joined the co-ops, those 23 co-ops that were given more than $2 billion. 18 of them have failed. Or when you look across the United States, those more than 3,000 counties, but now 1,022 of them, those counties, 1/3 of America, only have one health care insurance company. That's the real challenges that continue to fail as we go. That's why we cannot slow down. We have to repeal and we have to replace it. And when you look at the functions of what we're doing, focusing on the individual, focusing on the care, the betterment of all of America, these two individuals and their committees are doing the work. Now this week we're continuing to make sure we're reforming and getting the regulatory process in America working right. When you look at the Congressional Review Act, only one time in history has one ever been signed into law. 2 will be signed this week. We'll have passed our 13th by the end of this week. Kevin Brady will actually be on the floor going through unemployment insurance drug testing. So many have been addicted in the past. We should not continue to help the very poor habits, but we actually should give states more flexibility, getting people back to work. That's exactly what we're being able to do. When you look at these reviews, Congressional Review Acts, what we're doing, especially regulatory, we're helping America get back to work, finding common sense regulations. But also in the long run, what we're doing is making sure a level playing field, that states have the flexibility and the protection. So we look at the other one that we're dealing with when it comes to Retirement planning, making sure those individuals have the same protection in the private sector as also in the public. And I think that's very important, looking out after the individual, that what this Congress wants to make sure they do. I yield back.
Well, happy Valentine's Day to my lovely wife, Jennifer, back home. I think we know what the speaker's going to talk about, too. And to all of you, of course. Look, for years now, Americans have been telling us all across the country that Obamacare's failed. It's failed families. If you look at what it's done in the practice of medicine, we've seen so many doctors leaving the practice of medicine. In fact, a lot of them have ran for Congress and got elected to Congress to come and help rescue people across this country from the failures of Obamacare. And the good news is we've been listening to them, and we've committed that if we finally get the opportunity with the Republican House and Senate and White House, that we would repeal this law and actually replace it with reforms that put patients back in charge of their health care decisions. Healthcare decisions are too important to be made by unelected bureaucrats here in Washington. And what we're working on is legislation that will actually put that control back in the hands of families and patients and get it out of the hands of these unelected bureaucrats. And we're focused on lowering costs for families. One of the biggest failures of Obamacare is that it's made healthcare more unaffordable and more inaccessible for families, with double-digit increases in my home state of Louisiana, a 25% increase in health care costs for hardworking families over what they were paying last year. And last year we saw costs going up again because of all of the unworkable mandates and taxes in this failed law. And so there is relief. There's help coming. Our committees have been working on this. Our committees have actually been engaging governors in this process, hearing from people all across the country that have really good ideas about how to put the control of healthcare decisions back in the hands of patients and focus on lowering costs. It's exciting to see that we've listened to Americans and we're actually doing the hard work. And this isn't going to be some bill written in the back room like Speaker Pelosi did back on the day before Obamacare came to the floor, where she literally wrote the bill in a room where nobody could read it, and it was voted on with people who had never read the bill. This bill is actually being worked on by all of our committees of jurisdiction in public view. You can actually watch it on C-SPAN. Hearings have been held already. More hearings are being held. Committees will be actually taking legislation and having votes and marking them up where people can watch this on C-SPAN. It's a much better change, a much better process, and it's going to result in much better health care for Americans all across this country.
Happy Valentine's Day, everyone. And especially Brian, who proposed to me 11 years ago today. He did it right. As we approach our work as a unified Republican government, our 200-day plan, one of our top priorities is to repeal and replace Obamacare. And with the confirmation of our colleague, Tom Price, as Health and Human Services Secretary, we are excited to see him in that position, and we trust that he is the best choice to lead in this effort. And his confirmation is just one of those additional steps as we move forward with the repeal and replace of Obamacare. We're on track. Our committees are going to work on tax credits, on health savings accounts, on Medicaid, on restoring a robust insurance market. Really pleased to have Chairman Walden and Chairman Brady with us today to go into more details on these efforts. We're continuing to work to repeal Obamacare and replace it with a 21st century healthcare system that works for everyone, including the most vulnerable in our communities, the people with disabilities, the people with pre-existing conditions, the people who need help. Our goal is to ensure that everyone has better access, better options. We want people to be empowered to make the best healthcare decisions for themselves. It's important to all of us. For all of us, it's personal.
All right, I want to start off by saying Happy Valentine's Day to my wife, Jana. I'm sure she's watching this on C-SPAN. Look, our promise to repeal and replace Obamacare is about two big things. First, it is about rescuing people from this collapsing law, where premiums are getting higher and higher, and the choices are getting fewer and fewer to the point where people just have no choices left at all. This law is in a collapse, and we have an obligation to rescue people from that collapse. It's also about building a stronger healthcare system for the country, one that gives every American access to quality, affordable care. Instead of fewer choices, we want our healthcare system to be truly competitive. Insurers should compete for your business and treat you fairly. Instead of more mandates, you should have the freedom and the flexibility to choose the plan that best meets your needs. Instead of more bureaucracy, the patient and the doctor should be at the center of our healthcare decisions. Instead of all of this uncertainty, instead of worrying about whether or not you have to find a new plan or a new doctor, you should have real peace of mind. That's what our healthcare system should look like. All of this will help lower costs and end the annual sticker shock of higher premiums. I fully recognize and respect the strong feelings that people have about this issue. We should be passionate about this issue. It is about people's lives. This affects every person and every family in America. That is why we are taking a step-by-step approach, so people can see the changes that we are making, so that they can see how they will help. And working with Secretary Price, we will have a stable transition where no one has the rug pulled out from under them while we work toward a better, more stable system. So this step-by-step approach will rescue people from Obamacare's collapse and give every American access to affordable, quality health care. This is how we deliver on our promise to the American people. This is why we're doing what we are doing. We have to stop the collapse, and we have better ideas that have been time-tested that will make sure that we give the American people the kind of relief they deserve. Questions? Nice shoes. Manu.
My wife agrees.
Yeah. Do you want to come up and say Happy Valentine's Day to her?
Happy Valentine's
Yeah,
Day.
all right.
Mr. Speaker, in your opinion, does the American public deserve to know whether the President of the United States directed Mike Flynn to talk to the Russian ambassador about the issue of sanctions during the transition?
Yeah, let me take a step back for a second. National security is perhaps the most important function or responsibility a president has. And I think the president made the right decision to ask for his resignation. You cannot have a national security advisor misleading the vice president and others. So I think the president was right to ask for his resignation, and I believe it was the right thing to do. Let's speak about Russia for a second. I've always been a Russia skeptic and hawk. New administrations these days try to get better relations with Russia. The Bush administration tried to get better relations with Russia. The Clinton administration, or Hillary Clinton and the Obama administration did the reset. So I understand it's reasonable and rational to try and improve relations with Russia. That's what new administrations inevitably do. But I'll leave it up to the administration to describe the circumstances surrounding what brought to this point. I think the key is this, that as soon as this person lost the president's trust, the president asked for his resignation, and that was the right thing to do.
Should Congress look into that?
I won't prejudge. I'm not going to prejudge any of the circumstances surrounding this until we have all of the information. Yeah.
Last year you said a travel ban was against our country's principles.
No, I said a Muslim ban would be against our country's principles, or a religious test. This is not that.
Well, this executive
Yeah.
order cuts off access to 200 million people, mostly Muslims.
Just to clarify, would you support an independent investigation into Russia's ties? And are you concerned that it seems the White House knew about all of this call and everything 3 weeks ago and did not?
So to my same answer to Manu's question, I think I'm not going to prejudge circumstances surrounding this. I think the administration will explain the circumstances that led to this. The Intelligence Committee has been looking into this thing all along, by the way, just involvement with respect to Russia. I think it's really important that as soon as they realize that they were being misled by their national security advisor, they asked for his resignation. I can't speak to the rest of the circumstances. I think we need to get all of that information before we prejudge anything. Right there.
Mr. Speaker, do you have any concerns about the president talking apparently about the North Korea ballistic missile test out al fresco at Mar-a-Lago?
Al fresco. I've never heard that in a press conference before. I don't believe that any classified information was discussed. So I think it's important that if classified information is discussed, it's discussed in what we call SCIFs. It's my understanding that no classified information was discussed, and talking about foreign policy at the dinner table is perfectly appropriate. Thank you.
Under what circumstances would you